Hemorrhages are one other important parameter that one need to look at. Usually, the disc hemorrhage is a sign of local vascular damage. Disc hemorrhage precedes the neuroretinal rim loss and the nerve fiber layer defect in that particular quadrant, and usually is an indicator of an ongoing damage. This is more commonly seen in patients with normal tension glaucoma. Disc hemorrhages are flame-shaped or splinter-shaped, and they usually are present in the infratemporal or the supratemporal quadrants. And one of the edge of the disc hemorrhage always is in contact with the optic disc, and the other side is on the nerve fiber layer. They're usually transient and they disappears by about 10 weeks, and they can be recurrent. Recurrent disc hemorrhages are to be looked with suspicion that eye may require lesser intraocular pressure compared to what it already exists, or maybe we are missing out on other vascular or other systemic conditions which may be contributing to this progression, and we have to reevaluate them. This is the photograph of a patient with showing a disc hemorrhage supratemporally here and an inferior notch. Note that the superior rim is quite healthy here, and the same patient who presented a few years later, you see the area where the disc hemorrhage was present supratemporally now has loss of rim in that place. Because of the tessellated background, we are not able to very clearly look at the changes in the nerve fiber layer, but otherwise, if you saw an eye, typically this loss of rim is also associated with loss of retinal nerve fiber layer in that place. The disc hemorrhages are not only present in a glaucomatous eye, they also can happen in non-glaucomatous eyes, and usually the non-glaucomatous disc hemorrhages are not the typical disc hemorrhages that were described earlier. They can be present on the surface of the disc itself, or they could be present in unusual locations like on the nasal side. They could be unusually broad, or they could be away from the optic disc margin that like is seen in this picture. This can happen in patients when we have a posterior vitreous detachment, or those patients with microvascular disorders, or those who are on anticoagulants. So these disc hemorrhages may not be typically glaucomatous.